Hello, bonjour. My name is Alyssa.
And my name's Tyler.
And we're fourth year medical students at Awesome University. And today we're going to be presenting our project titled Evaluating the Quality of French Language Services in a Northeastern Ontario Emergency Department. We have no conflicts of interest to declare at this time.
If we look at the literature that already exists on French language services, it's made clear that language discordance between providers and patients poses a risk to patient safety, and it does so by increasing diagnostic uncertainty, increasing the risk of medical errors, and by contributing to ineffective patient counseling. Now, the population of French-speaking individuals in Northeastern Ontario is quite significant. Specifically in Sudbury, Ontario, where we conducted our study, nearly 22% of the population identifies French as their primary language. Health Sciences North, a hospital in Sudbury, is defined under the French Language Services Act as a fully designated bilingual healthcare institution, which means that patients accessing care at HSN have the right to communicate in French and to receive all available services from the institution in French. Now, this requires the institution to utilize the active offer of French language services, which is a regular and permanent offer to provide French language services, which is brought to the attention of the patient upon very first contact with the healthcare institution. We chose to utilize a mixed method study where we collected data from web-based questionnaires which were made available by QR codes in the emergency room, in the Centre de Santé Communautaire clinics, as well as online. Participants completed the study and were eligible if they were greater than the age of 18, self-identified francophone, and had recently received care at the Health Sciences North emergency room within the previous 6 months. Qualitative data underwent thematic analysis via blinded cross-triangulation, and quantitative data underwent statistical analysis.
For our results, we had 56 participants that responded to our study in its entirety. So starting off with some of the quantitative results, 50% of participants, so half, endorsed a lack of staff with French language skills and stated that the environment didn't seem favorable for the use of the French language. 30%, about a third, felt judged for requesting services in French and thought the staff seemed too rushed to provide services in the French language. 90%, almost all participants, believe that there's an existing lack of services in the French language, but also believe that it's important to receive French language healthcare services. Through our thematic analysis, we highlighted a lot of key important themes, and we're able to organize those into 3 main categories. So those being staff-centered barriers, institutional and systemic barriers, and impact on quality of care. Throughout our study, we saw that francophones commonly receive linguistic discordant care in the emergency room at HSN. The study highlights the challenges and gaps faced by francophones when attempting to access French language services. And French language services provided to patients are often of lesser quality than those provided to English patients. But despite this, francophones feel strongly that it's important to receive care in their mother tongue. As you saw throughout this presentation, a lack of access to French language services is a risk to both patient comfort and safety. Healthcare providers such as Tyler and I, institutions and stakeholders have to collaborate to develop lasting solutions to improve the accessibility and quality of French language services and to subsequently improve health outcomes for minority French-speaking individuals in Northeastern Ontario.